Hello, my name is Michelle, and today I will be presenting my final project on the recovery process through mental imagery. My introduction. Psychological interventions are known to be very useful tools to assist people with their daily stressors. Some examples of psychological interventions will be modeling, expressive writing, counseling, and relaxation techniques. Today's presentation is going to be focused on imagery, which is another type of intervention. The purpose of this presentation is to introduce the use of mental imagery as part of the sport injury rehabilitation process. It is also to assist athletes in coping and dealing with the stressors associated with their injury. The population targeted is college student athletes, academic year freshman, sophomore, junior, and senior. This means that the age gap will be between 18 to 24, 25 years old. All college sports competing in the NCAA are part of this population, and they are recovering from mild or severe injury. So all these student athletes are going through the recovery process. Considerations of the target population. So it is known that sport injury can be a traumatic event that can affect not only physical but also psychological health. Therefore, we have different type of stressors depending on the phases of injury. We have stressors during the onset of the injury, stressors in the rehabilitation process, and stressors in the return to sport phase. Research suggested that the stressors that are included in the onset phase are isolation and incapacitation. This occurs because the athletes are not able to attend practice anymore or to be part of the competition. So they feel lonely and they feel that they are not part of the team anymore. Then during the rehabilitation phase, the lack of progress or any possible setbacks are really stressful for them. During the return to sport phase, the main stressors are the fear of re-injury and also the concern of losing their fitness. They are mostly concerned that they will never get their pre-injury performance levels back. Then it is important to consider for this population, social support is very important when providing psychological help. Because this population is not only dealing with the stressors from the injury in the sports, they are also students at a college level. So they need much more support and a really great support network to be able to handle all these different stressors. Now we will introduce imagery as a psychological intervention. Imagery consists on reproducing or visualizing an object, scene, or sensations as thought it were occurring in the physical reality. It evokes the physical characteristics of an absent object, event, or activity that has been perceived in the past or may take place in the future. Also, imagery incorporates all five senses. You can use audition, vision, olfaction, gustation, and kinesthetic. All of these can be involved in the imagery process. Application to sports. So many athletes, coaches, and sports psychologists have recognized the usefulness of mental imagery in enhancing sport performance. However, we cannot say the same in the rehabilitation process. It has been shown that the use of imagery during the recovery process appears to be largely underutilized because of the lack of understanding of how imagery works. That's why it is important to teach athletes and everyone around them about the different techniques and how to properly use these techniques. Now we will focus specifically in sport injury rehabilitation. So according to Kupal, the physically demanding nature of sports can generate the conditions for the incidence of injury and consequently provide arena for the examinations of psychological techniques in preventing and treating these injuries. That's why researchers have discussed the use of these psychological strategies in conjunction with the sport injury rehabilitation, because it has been shown that using both at the same time has better results than only using physical treatments. It is important to work with both physical and psychological issues at the same time. There are four main types of imagery that are used during the recovery process. First, the healing imagery. It consists of visualizing and feeling the injured part healing. So the athlete, if the athlete have a knee injury, they might think about the knee, how it's anatomically healing. It can be used to envision the internal processes and anatomical healing that take place during rehabilitation. And then it has been shown that for it to work and be efficient, the athlete must be fully aware of all the different aspects of their injury. So if it is a knee injury, they must know how severe it is, what ligaments are compromised. They need to know all that to be able to visualize the healing. Another type is the pain management imagery. It requires the athlete to create image of him or herself free of pain. This can help better cope with pain, reduce pain levels, and subsequently help the athletes with the emotional and behavioral responses that are associated with injury. Because most athletes reported that the most difficult part of the recovery process is the constant pain, or in some athletes chronic pain that they need to deal with daily. So imagining that the body part is not painful anymore can help them with all these different issues. Another type of imagery will be the rehabilitation imagery. It consists in the athlete creating images of the many different aspects of rehabilitation, such as completing the exercise successfully, adhering to the program properly, overcoming any difficulties, any setbacks. This type of imagery assists the athlete in dealing with challenges during the rehabilitation program. So, for example, if they are experiencing a setback, they already imagine themselves overcoming this setback. So that will give them motivation, and that will let them continue and know that they are able to overcome these difficulties. And the last type of imagery will be performance imagery. This is mainly to facilitate the return to sport phase. It consists on athletes rehearsing sport-specific skills during the rehabilitation process. By doing so, they will increase confidence in the ability to return to their sport successfully. It may help reducing anxiety and stress by imagining themselves back at play. Now we will discuss where and when injured athletes use imagery. Different research has suggested that athletes use imagery less frequently during rehab than in training and competitions. Most athletes assume that they use imagery much more during the competitions to imagine themselves either winning or doing different plays. So that's more common for them. However, most of them indicated that the use of imagery in the rehab process is not that common. Also, the athletes gave accounts of using imagery outside of rehabilitation, but only for rehabilitation purposes. For example, they can use pain management imagery outside of rehab, but just to focus on those purposes. And then the most frequent cited places were at practice when they were not participating, and at home in bed and while driving. Finally, using imagery when alone was also mentioned by several athletes. now we will discuss why injured athletes use imagery. Why are the functions? So there is two main functions, which is cognitive and motivational. The cognitive function consists in the rehearsal of a specific movements or rehabilitation exercise. Injured athlete indicated using imagery to help them perform specific rehab movements before and while performing these movements or exercise. And the motivational function involves the visualization of goals and associated activities. Athletes in this particular study maintained that the motivational functions of imagery were the most important and most widely employed functions of imagery during the rehab process. So the conclusion of my presentation is that imagery in sport injury rehabilitation seems to have four main purposes overall. The first purpose will be to facilitate the actual healing process. This will be by using mainly the healing imagery and by using it in the pain management process. So by overcoming those difficulties, the recovery process will be positively influenced. The second purpose is to promote positive and relaxed outlook towards recovery. The third purpose is to create the required mindset for optimum performance. If they imagine already that they will be successfully after the recovery process, then it will positively affect their mental health, and they will give them the motivation needed to actually complete the recovery process. And the last purpose of using imagery is to provide a closure to the injury experience. So after they finish their recovery process, if they could imagine themselves returning to sport successfully, and they actually can do it when they are ready, then they can close the injury phase completely and start rebuilding to their pre-injury performance level. Finally, my references, and that's it for today. Thank you very much.